Oh, got it. Okay, well, hello, students. Mrs. Goad is here again, and I am actually interviewing my mom, Pam, who is both a nurse and a practice administrator for a private practice, an ear, nose, and throat practice. So I'm excited to have her here and to hear all about her job and how she got into this career. So, Mom, you just start by telling everyone who you are, who you work for, and what your day looks like in your job.
So I am Pam Kraus. I'm a registered nurse. I've been a registered nurse for a long time. Since most of you, prior to any of you being born, 1979, I started my full career in nursing as a registered nurse. Currently, I am the practice administrator for an ear, nose, and throat practice, which means I oversee not only the clinical nursing department, but all of the other departments as well, getting into finance and billing of a medical practice. And we do a little bit of everything. So as a practice administrator, it doesn't pigeonhole you into one little area of being just a nurse. You have to be able to do human resources. You have to be able to do financial projections. You have to be able to look at numbers and project what you are going to be making at the end of the year. It's fun because it doesn't, no day is the same as another. You may walk in and you may have staffing issues. You may have to pitch in to help answer phone calls, or you may have to room a patient and take care of a patient's needs at any given time. So every day is a new day. That's what makes it interesting.
That's what I like about my job too. Every day is a new day. It's something new to tackle. So you've been doing this, you started in 1979. So we already know how long you've been doing this, but I would love to know, when you were in high school, did you think this was the career field you would get into? And if so, what subjects in high school do you think helped you as you entered college for this career?
So high school, that was a long time ago. Yes, I always knew I wanted to be in medicine of some sort. Actually, when I was really young, I thought I wanted to be a nurse. And then as I got a little bit older and I was in high school, I was interested in X-ray technology. But at the time, X-rays were not as safe as they are now as far as radiation. So my mother, being the mother that she was, would not let me go into that field. She said, you need to go back and really become a nurse. It will give you a lot more freedom. You'll have a lot more opportunity. So I took her advice and I went into nursing school. Some of the subjects that I took 3 years of Latin. And I really feel like Latin was where I learned the basis of medical terminology, because a lot of medical terminology is based on Latin verbiage. I also took Spanish, and that didn't really help me much with medical terms, but Latin helped a lot. Science is heavy in a lot of biology, chemistry, that kind of thing. And I always liked science. I always like to take things apart, look at the inside of things. People say that they hate blood and guts when they go into nursing. Oh, I could never do that. It's not all about just blood and guts. It's really about whether or not you care for people and you want to help them. Really having a passion for wanting to help people and wanting to have strength in their health continuum is important. Getting people to become healthy is where medicine is right now. It's not so much about taking care of your illness, it is about that. The doctors take care of the illnesses, but the nurses help teach patients on how to stay healthy. And that's where the focus is of medicine these days.
I think if I had known that, I might have gone into nursing. Because the blood in the guts part is what turned me off of it. But I am really into health and promoting health in people. So it might have been a good field for me. Most of my students, oh, I'm so sorry. Most of my students know Charlie. So we're going to say hello to Charlie.
Hi, Charlie.
Charlie, say hi to your Nana.
Hi, Charlie.
Joins us for many a meeting, and now my students know Charlie. So, Charlie, we're asking your Nana some questions about her job as a nurse. Okay. So we know how you got into it. We know that you thought that you were going to do that in high school, which is awesome. How long did you go to school for?
I went to school for 3 years. So back in the day when I was going to school, you got an associate's degree in nursing. Yes, some people went on and got bigger degrees, but this was back in the late 70s. So most people only got their associate degree in nursing. I spent 1 year getting my prerequisites done, my anatomy and physiology, my math, and all the other things that I needed to do. And then the second 2 years, I focused just on nursing.
So nowadays, so that most of our students know, you would need to at least have a bachelor's in nursing.
Right.
Is there continued education for the administration piece?
No, not in New York State. Every state is different, though. And
Okay.
even in New York State, we don't even have continuing education for the clinical side of things, other than to make sure you have, this bloodborne pathogen, OSHA safety, making sure that you're not sticking yourself with a needle, that kind of thing.
We have those same trainings working in a school.
Right.
Cool. So let's see. Can you tell us what type of technology you use in your daily position?
Technology has changed over the years. Probably the biggest piece of technology that every nurse, no matter where they're working, is computers. You all know about computers. Well, electronic medical record is the we call it an EMR. That is the latest and greatest thing in the past 20 years that has come out of medicine. It really has developed over the past few years in that computers can now talk to one another. So if I have a patient that comes in and they have had blood work done at a hospital, or they've had an x-ray done at a hospital or another doctor's office, that information can automatically come right into our computer system through different regional health information centers, where they have these big hubs of computers and they house everyone's information on it, to different computers being able to encrypt data and send it over encrypted to another computer. So really understanding how to use computers is key. And I know that all the young children these days, I love when I have, a 20 or 30 something person that comes into work versus somebody my own age, because they all know how to do all the computer stuff. And sometimes people my age sometimes don't know how to use computers, but it's vital now. Everything is computerized. Every piece of equipment in a hospital is computerized. Every piece of equipment we have here is computerized. So learning to understand those.
I would think our virtual students will have a little leg up on that because they spend so much.
Absolutely. Yeah.
They helped me use my computer.
What's interesting now is during the pandemic, we didn't know how we were going to see patients. So in ENT, I work in an ENT practice. What is that? That's ear, nose, and throat. That is kids who have frequent ear infections, throat infections, sinus infections. I'm sure at some point, most all of you have had this. And because of the way infections travel through airborne droplets. That is also how COVID traveled. So we had to learn new ways of seeing patients. And we now do it virtually. So we have seen patients for ear, nose, and throat problems over the computer, and that has really opened a lot of avenues for the physicians to be able to see more patients, to generate more revenue, take care of patients over the phone. Even if it's somebody that's new, we can see them, we do a consult with them, and we put a plan together. So when they do come back to the office, we know exactly what we're going to do.
Well, yeah, I've been really happy to be able to do a lot of my appointments virtually as well.
Right.
So I have another question for you. I've been asking everyone I interview at the end of our interview, what are you looking for in an applicant? So when you are hiring a new nurse, what are you looking for?
Well, one, are you able to use the computer? Do you understand how the computer works? I'm looking for technical skills. I need to know that my nurses understand what they're doing, what the technical terminology is for that area. I used to be in primary care, so you had to know the entire body. Now my nurses need to know, what are the functions of the ear? What are the nose, the turbinates of the nose, the different parts of the nose, the different parts of the ear, how having a blocked ear, how dizziness can affect your life, and how we can make it better, or what the patient can do to make it better. So I'm really looking for technical information, someone who is a self-starter. You need to be able to not have to be told every little step of the way what to do. You need to be able to foresee what may happen next, or what the doctor is planning to do next, so that you can be prepared for either the phone call that's coming in or the patient that's coming in. What are the needs going to be of that patient? Being able to project and, really able to, read a note, comprehend it, and think about what the outcome is going to be.
Very cool. Yeah, I mean, it's just like any career. We're looking for people that are able to think on their feet.
Mm-hmm. Be consistent with attendance, be timely. You need to show up on time. You can't call in sick every day, because in every aspect of medicine, you work with a team. You don't work by yourself. I don't work by myself. I'm part of a team. And when someone's not there, you have just let your team down. It's like being on an athletic team. When you don't show up for the game, you've let your team down. The same thing happens when you go to work.
Got it. Yeah. I have one last question for you before we finish up. I got thinking about the pathway to your career. We talk a lot with our students about the pathway to a career. And most people do not go right into administration. Am I correct? They start out as a nurse, or they start out another part of the medical field before they become an administrator. Is that accurate to say?
That's right. Mm-hmm.
Okay, so you spent several years in the nursing field and then moved into administration.
Right. There were a lot of learning, a lot of bumps and bruises along the way. I have done the ideal thing, when you think about your career path, is that, you may not want to do what you think you want to do for the rest of your life. The thing that I'm very fortunate about with nursing is that with nursing, I can do anything. I have done so many different things. I've worked in nonprofits doing health education. I have worked as a clinical nurse doing real nursing, giving shots, taking blood pressures. I've worked in home care, visited people's homes, doing dressing changes and taking care of patients in their homes, working in the hospitals. You can do so many different things. So a career in health, any kind of the health education or any kind of health career now opens up many doors for you, because there's not enough people that go into healthcare that really are passionate about it. So your career options are plentiful. It's not pigeonholing you into one area. So you start out with a licensed registered nurse or a licensed practical nurse, whatever that might be, and you grow from there wherever your interests might lie.
And you are actually giving out vaccines to
Yeah.
people, 19 vaccines as a side job on the
Yeah.
weekends. And all stay healthy from COVID-19, which is really
Right.
cool.
That's
Well,
right. And that's fun. You know, I get to talk to
Yeah.
patients. I get to do all the things that I don't get to do in my regular job, Monday through Friday. So it's fun. You work a long hours. We work 12 hours a day, sometimes 15 hours a day. And all we do is talk to patients, see how they're doing, how are you feeling? And we give shots all day long. So
Awesome.
you know, we're getting everybody healthy so that we can get life back to what we know it from over a year ago.
Yes, for sure. Well, thank you so much. I'm so
Thank
glad to
you.
have the opportunity to interview my students. Thank you. I'm going to turn the recording off so that
All
Charlie
right.
can finally say hello to you.
Hi, Charlie.